Really important information for moms-to-be now. New guidance today from the CDC is now urging all pregnant women to get vaccinated against COVID-19. The advice comes as some hospitals are seeing high numbers of unvaccinated mothers-to-be seriously ill with coronavirus. Joining us now to get more clarity on this new recommendation is Dr. Brennan Fitzpatrick, Chief Medical Officer at Deaconess Women's Hospital. Dr. Fitzpatrick, thank you so much for joining us today. This new guidance is much stronger than the CDC's previous just encouragement for pregnant women to get the vaccine. Why the change?
Right, absolutely. And I think that the CDC is joining the groundswell of professional organizations involved in women's health that have made stronger statements within the last week or two. Really, I think it all boils down to a couple of things. First and foremost, I think there's clear and present danger in the form of the Delta variant. There's no question that cases are on the rise, particularly among unvaccinated individuals. And I think as you start looking at the data that we have with respect to pregnant patients, patients that are breastfeeding, patients that are pursuing fertility, we are seeing that the vaccine is unquestionably safe and unquestionably effective, and there's ample data to support that.
Yeah, I know there's new data that the CDC is citing that's saying that the rate of miscarriage is around 13% whether you're
Correct.
vaccinated, which is pretty much normal, as I understand it, correct?
Right. When we talk about miscarriage rates, somewhere in the neighborhood between 10 and 15, 11 and 16%.
So that kind of indicates that the vaccination doesn't really raise your chances of having a problem, correct?
Relative to fertility and miscarriage, absolutely not.
Okay, all right. Now, what are you seeing locally? Are you seeing pregnant women coming in with COVID, and how serious is it? Are they being hospitalized?
Yeah, absolutely. We, I think came on in May and June, kind of talking to people about the fact that we were seeing an uptick in the number of pregnant patients that were coming in and requiring oxygen, requiring intensive care, and that continues to be the case. All of the things that that have come out with respect to risks during pregnancy and increased risk for hospitalization, an increased risk for intubation, an increased risk for ICU admission. Those are all things that we're seeing here in our community. And ultimately, it's been significant. I often tell people that there's never been a point in my career where I've seen one issue as significant as this lead to patients presenting with respiratory failure.
I've read and I've heard anecdotal accounts of mothers to be wanting to protect the baby, and they think the way to do that is to wait to get the vaccine. They don't want to risk the baby, they're saying. But as I'm hearing you, there's a risk in waiting as well, correct? The coronavirus is a risk.
There's no question. And one of the things that I didn't talk about, I talked a lot about maternal risk, but when we talk about fetal and neonatal risk, we know that there's an increased risk for preterm birth. Many of the patients that we've had to deliver 28, 29, 30 weeks, which is 3 months earlier in some cases than should occur. And these babies are at increased risk for significant long-term complications, cerebral palsy, difficulty, long-term issues with breathing, issues with blindness. So, it's not a no-risk proposition for, mothers that are delivering preterm. And again, we know that COVID is associated with that risk.
So am I hearing you in that you're saying, or maybe the question should be, do the advantages of getting the vaccine get passed not only for the mother, but get passed to the baby as well?
So there is some literature out there that suggests that the antibodies that mom creates do pass to the baby, both via the placenta during the time that mom's pregnant and during lactation. There's not a ton of information on that right now. I anticipate that as more women get the vaccine, that data will be forthcoming. But at the end of the day, we do think that there is a potential benefit.
All right, Dr. Fitzpatrick, we are really out of time, but I want you, just one last thing. What's the big takeaway here? What do you advise pregnant women to do?
I think we strongly encourage for women that are pregnant or pursuing pregnancy or breastfeeding that they receive the vaccination.
All right. Dr. Brennan Fitzpatrick, Chief Medical Officer of the Women's Hospital, thank you so much for coming on today and talking more about this very important topic.
Thank you.
Thank you.